HIV, the three letters no one wants to hear. What are the symptoms of HIV? Who should be tested? How is HIV spread? These are all the questions we will answer on My Health Spot. Welcome to My Health Spot. Hello, my name is Dr. Jorge Sanchez, Family Medicine Board Certified Physician. Today we're going to talk about HIV. What is HIV? Well, HIV stands for Human Immunodeficiency Virus. It can be spread by the sharing of body fluids, both blood and sexual fluids. This includes vaginal secretions and semen, and is considered an STD. Let's talk about how HIV works. Once a virus is acquired, it circulates in your blood. Your immune system, and specifically your white blood cells, will do what it does normally and will engulf the virus in an attempt to destroy it. HIV is actually very smart though. When it is engulfed by your white blood cells, the genetic material of the virus will integrate itself into your DNA. It will then lay dormant for many years. So instead of destroying the virus ends up living in your own immune system within your own very DNA for quite a while. At some point, the virus will start to massively replicate itself and wreaks havoc on your immune system to the point where your white blood cells are greatly depleted. This leaves you just very susceptible to rare, dangerous infections such as fungal infections, tuberculosis, and many other types of bacteria. Now, a person with a normal immune system would generally not be affected. However, for someone with a low immune system with HIV, these infections are potentially deadly. The later condition is known as AIDS. So HIV is a virus that causes the low immune system. AIDS is the condition of having a low immune system and the infections that follow. AIDS is what actually is potentially deadly. Now, there are medications that can suppress the virus. This allows the immune system to recover and prevent AIDS from occurring. Those with HIV who take the medications can expect to live a long and full life. The Center of Disease Control, known as the CDC, recommends that everyone between the ages of 13 and 64 get tested at least once, regardless of risk factors and regardless of symptoms. But the recommendation changes if you have risk factors. Those with risk factors should be tested every year, and those with very high risk factors should be tested every 3 to 6 months. Very high risk factors include gay men and bisexuals who have multiple sexual partners. So who is at risk? Those that are at risk include those who have sex with a known infected person of HIV, particularly with unprotected anal or vaginal sex. If drug users share their needles and syringes, this is also a risk factor. Men who have sex with men are at particularly high risk, and those with a previous history of STDs, which includes herpes, chlamydia, and gonorrhea, are also at high risk of acquiring HIV, as well as victims of sexual assault. Unprotected sex with multiple partners can be a risk factor, and also sex workers who exchange sex for money or drugs are at a high risk of acquiring HIV. Healthcare workers, including phlebotomists and nurses, can be stuck accidentally when drawing blood, and this is also a risk factor. Now, receiving a blood transfusion is not considered a risk factor unless it's been a transfusion given prior to 1984. So what things are unlikely to cause HIV transmission? The things that are unlikely to cause transmission that a lot of people worry about include certain fluids such as saliva or sweat that get in contact with the eyes or mouth. This is very unlikely to cause infection. Oral sex is unlikely to spread the infection, but not impossible. Again, urine, saliva, and sweat are unlikely to spread HIV. Human bites are the exception. If somebody bites you and if the person has HIV and the bite breaks the skin, that can cause HIV transmission. So what are the symptoms of HIV? First of all, not everybody develops symptoms. There are early signs that can develop between 50 to 90% of patients. This usually begins around 2 to 4 weeks after exposure. Initial signs are called primary or acute HIV. The initial symptoms are very similar to the flu and often go misdiagnosed. During this time, patients are considered very infectious. Symptoms include a fever of 100.4, a sore throat, headache, muscle, and joint aches. Symptoms will typically last about 2 weeks. Also, painless swelling of lymph nodes of the armpits can develop. Open sores can exist of ulcers in the mouth, esophagus, or penis. These can resemble herpes and can go misdiagnosed. The sores are typically very painful. A rash can also develop 3 days after a fever and usually affects the face, neck, and upper chest. The rash will last about 8 days. Also, nausea, vomiting, diarrhea, and a lack of appetite and weight loss can occur. Some people also have a dry cough. Because these symptoms are very similar to the flu, it can go undiagnosed. If a person has high risk factors during the flu season and has typical flu symptoms, it should not be written off as the typical flu. They should be tested for HIV. So, if you do have flu-like symptoms and also have high risk factors for acquiring HIV, don't be afraid to talk to your doctor to get tested. This is particularly important during this time because you are very infectious and the most likely to spread HIV. How is HIV diagnosed? There are 3 ways HIV can be diagnosed, but before we start talking about the first way, it's important to start talking about immunology, which is a fancy word for how our immune system interacts with infection. In a healthy person with a properly working immune system, when you're exposed to bacteria or a virus, your immune system will cause white blood cells to engulf whatever is causing infection. They're like little fat soldiers that run to the infection and kill it by sitting on it or tackling it. This destroys the infection. It's actually the process of destroying the infection that causes a lot of symptoms like fevers, chills, and body aches. Once you're recovering, your white blood cells, your little fat soldiers, they'll send signals to your immune system to produce what's called antibodies. The soldiers say, "Hey, immune system, that wasn't fun at all. Let's not do that again. Send me some watchdogs that can look out for the specific infection." Here's the description. If the watchdog sees an infection, tell it to attack. So the immune system sends out watchdogs, aka antibodies. Now, these antibodies don't really look like dogs. They look like little forks with 2 prongs on them. They recognize any kind of bacteria or virus that had been around before. The next time the infection tries to make a comeback, the antibodies will attack by attaching themselves to the bacteria or virus and marking it for destruction before there are any symptoms that develop at all. We can actually measure these antibodies or watchdogs in the lab. They represent exposure to an illness. In a normal situation, you get rid of the infection, but in HIV, you're not able to kill the virus. A positive antibody test shows you that you currently have HIV. This is the first way we diagnose HIV. Now let's talk about the second and third ways we diagnose HIV. In addition to looking at antibodies we just talked about in the first method, we can actually detect HIV virus itself. The first way is to look at the surface molecule HIV. These surface molecules are called antigens. These antigens can be tested in the lab. This is the second way we diagnose HIV. We can also test for the genetic material of HIV. This genetic material is called RNA, or also known as ribonucleic acid. This can also be tested in the lab as well. To give you a little more detail of this method, RNA is very, very small and needs to be amplified in the lab in order to detect its presence. We can amplify the genetic material by what is called PCR, or polymerase chain reaction, and it makes it easily detectable. Another term for PCR is also viral load. This is the third way we test for HIV, the viral load test. So in summary, there are 3 ways to test for HIV infection. The first way is to check for antibodies, which is measuring our own immune system to determine exposure to the virus. It's kind of like testing for the effects of HIV. The second way is to test for HIV by looking at its antigens. It looks at the actual virus. The test is often combined with the first method, the antibody test, into what is called the combination test. Remember that, the combination test. And the final way is the test for HIV. It's called the PCR, or viral load test, which shows us how many copies of the virus are in 1 drop of blood. So we have 3 ways of diagnosing HIV. That really breaks down to 2 tests, the combination test and the viral load test. Now, if there are symptoms for HIV or if there's a recent exposure, then this combination test is also performed along with a genetic test that counts how many copies of HIV RNA are present. That's the viral test that I mentioned earlier. In essence, if there are symptoms, you do all 3 tests together to find if there's early HIV. The reason for this is that the viral load test will turn positive first, several weeks before the combination test will turn positive. The advantage of testing with all 3 tests is that we can look at the pattern of positive results and figure out approximately when the infection was acquired. The old way of testing, which includes doing an ELISA test first and then confirming it with a Western blot, is no longer recommended, as this can miss early infection and will test negative for those who truly have a positive HIV. If the exposure occurs several weeks to months ago, it's reasonable to just test for the antibody. The earliest the PCR will become positive is typically about 10 to 15 days after exposure. If you were tested before that, then it's important to get retested 2 weeks later. Home Access HIV test is available and can provide accurate results in an anonymous way. It's available in some pharmacies. This type of test requires a small amount of blood by pricking the finger, loaded onto a filter strip, and mailing it to the lab. The lab will perform the results and call you with the results. The results of the test are confidential and not reported to anyone but you. Another home test is called the OraQuick, which uses oral fluids instead of blood, and the positive results are generally pretty accurate. However, a negative result is not as reliable as a positive result. In fact, 1 in 12 with HIV will have a test that is negative when the person actually has HIV. Are there any ways to prevent HIV exposure? If you've been exposed to HIV accidentally by having a condom rupture, or if you are a healthcare worker and accidentally pricked by a needle in the hospital, then there is an option to start medications within 3 days. Again, this is most effective when there is an unexpected event and not for those who repeatedly place themselves in high-risk situations. Now, in those who repeatedly expose themselves for possible HIV, there is an option to take daily medications to reduce the risk of HIV. It's still important to use proper safety techniques such as using condoms every single time, as these medications do not guarantee complete prevention of HIV. Well, that's all the time that we have today. If you want to support us, be sure to support a cause. Unbound Now is an organization that seeks to rescue women from sex slavery and all types of human trafficking. So be sure to go to the website, which I've included below. Also become more educated on the topic, find out where your local chapter is, and also be sure to give financially, as this makes a great difference. Be sure to come next week when we talk about It's Worth the Wait, abstinence. Probably not talked about enough, and something that is an option for you. So be sure to come next week and we'll talk about that. You have a great day.